Hi, my name is Wendy Morales, and this is my sterile dressing validation. Before I do anything, I check the doctor's orders, I gather all my supplies, I identify my patient, I introduce myself to the patient, I explain the procedure, and I provide privacy. Now, like I said, I wash my hands first and put on my gloves. After I put on my gloves, I make sure I always ID my patient. Again, you are Mr. Smith. I will be changing your old dressing. Now, when I'm changing the old dressing, I'm very careful around the skin, not to pull the skin. Be very sensitive around the skin area. Throw out the old dressing, my gloves. I assess the wound and I take note to what I see so I could document it. And I wash my hands again. After I wash my hands, I will put my towel drape on my table. Then I will get my sterile bowl. I will put my sterile bowl down. Throw this out. Throw any wrappers out also. I will get my gauze pads. After I put down my sterile gauze, put down my ABD pad. Then, after I do that, I will put on my gloves. This will all be in the garbage, all the wrapping. But before I put on my gloves, I will put the saline solution into my sterile bowl. If I'm using a brand new saline, then I don't have to worry about initial date and time. But if it's not a brand new bottle, I will have to make sure it's not more than 24 hours old. If it's new, I will put my initials, date and time. I will grab it by the label, open it up, pour a little bit out, pour it into my bowl. Always making sure not to touch the bottle to the bowl. And now I will put on my gloves. Grab it from the inner lips, pull out. Grab from the outside. adjustments that I need. After I do that, then I will start cleaning the wound. Grab a gauze, dip it in the saline, squeeze it out, pass it without touching the glove, cleaning from top to bottom, throw out. Next, dip, squeeze, pass, top to bottom, throw out, gauze, dip, squeeze, pass, top to bottom, garbage. Then I will pack the wound. Grab my pad, blue line up. Now grab my tape and put the tape all around the pad, which is called window painting. How are you feeling, Mr. Smith? Just making sure you're okay. Now after I window pane all around the pad, make sure everything's nice and secure. We'll make sure the patient's nice and comfortable. Take off my gloves. Put the patient in a comfortable position. Lower the bed. And after all that's done, I will document what I saw from the wound dressing and what the wound looked like. Thank you very much, and I will of course wash my hands. Thank you.